Welcome to Lecture Bite Intro to Pharmacology Continued. This PowerPoint is going to cover prescription writing. The objectives for this PowerPoint: prescription writing, become familiar with the basic parts of a prescription written, as well as describing the parts of the prescription and prescription label regulations. Be familiar with schedules of controlled substances and provide an example for each schedule. Prescription writing. The dental hygienist needs to become familiar with the basics of prescription writing for the following reasons. Correctly written prescriptions save time for the office personnel, the dentist, and the pharmacist who must call to clarify an incorrectly written prescription. Prescriptions written carefully are less likely to result in mistakes. A record of the prescription should be included in the patient's record. Prescriptions should be written out, and Latin abbreviations should be avoided to minimize the risk for errors. However, we do review very commonly used Latin abbreviations, and in some prescriptions, they're very useful, but they should be written out very clearly so as not to get confused with how often to take a medication or the time of day to take a medication. Prescriptions write out the measurement of a drug in the metric system. It's the primary measuring system for compounding and dispensing medications. Solid drugs are dispensed in milligrams most often, and liquids are dispensed in milliliters most often. Rarely a drug may be dispensed in grams or micrograms. Converting liquids to household units for convenience is common, especially if you're going to give a child a liquid antibiotic or something like that. Parts of the prescription. Here is sort of an old school prescription pad, and you can see we have the heading, which has the dentist's information, the patient information, the date, the practitioner's license number, and their NPI number. Then we have the body, which is going to have the name of the drug, what's being dispensed, and how to take the drug. And then we have the closing, which is going to have refills, instructions such as a generic is allowed or dispense as written, the doctor's DEA number if it's a controlled substance, and their signature. The heading and the body are going to have the name, address, phone number of the prescriber, name, address, age, and number of the patient, date of the prescription. The body is going to have the prescription symbol, name and dose or concentration of the drug, amount to be dispensed, and directions for the patient of how to take it. The closing is going to have the prescriber's signature, their DEA number, and refill instructions. In most states, the patient of record, the person for whom the prescription is being written, is a patient of record. So there's no next door neighbor or relatives unless they're also patients of record who could fill that prescription. Dental conditions. The condition for which the prescription is being prescribed is a dental or related condition, no birth control pills or thyroid replacement drugs. So in most states, these are regulations for the dentist. A dentist can't prescribe things outside of his or her expertise in dentistry, and they must be a patient of record. These are abbreviations commonly used in prescriptions. They will avoid them unless there's a lot to be written, and then these are the commonly used abbreviations. So it's very common to see DISP for dispense instead of writing out the whole word dispense. These are the ones that are particularly important to know. Things like twice a day, BID, or 4 times a day, QID, those must be written very clearly as to not confuse it. There's also 3 times a day or twice a day. CAP for capsule, D for day. These are less likely that we'll be familiar with them, but GTT for a drop. So if it's a liquid, an hour, 2 hours prior to, so something might say 2H AC, so 2 hours before meals, something like that. But again, for safety, it's always better to write these out very clearly. But if a prescription does contain an abbreviation, it needs to be written very clearly so a B isn't confused with a P, or a Q isn't confused with a G, or something to that effect. Drug schedules. Federal law divides controlled substances into 5 schedules according to their abuse potential. Drugs on the market may be moved from one schedule to another if something changes or something is discovered. Any prescription for a controlled substance requires a DEA number. All Schedule 2 through 4 drugs require a prescription. In the works, the U.S. Department of Justice initiated in 2024 rulemaking to reschedule cannabis to a Schedule 3 of the Controlled Substance Act. The majority of 2024 public comments supported descheduling, decriminalizing, or legalizing marijuana at the federal level. So that is in the works. So that might happen in 2025. But currently, for the drug schedule, Schedule 1, we have examples such as heroin, LSD, marijuana, and hallucinogens. Number 2, Schedule 2, oxycodone, morphine, acetaminophen, or amphetamines, excuse me. Schedule 3, codeine, mixtures of the type such as Tylenol 3. Schedule 4, diazepam, Valium, benzodiazepines are on this list. Schedule 5, they're the least potential for abuse. Some codeine-containing cough syrups would be an example. Additional points from Chapter 1. The dental hygienist should understand the importance of obtaining patient health medication history. Ask yourself again, why is it important that I know my patient's medications and their history? The dental hygienist should have an in-depth understanding of pharmacology because many dental hygienists are now licensed to administer local anesthetic and nitrous oxide. The dental hygienist should be able to explain to a patient how to take a prescription or a non-prescription medication. So if they have the prescription there, the dental hygienist should be able to read it and explain the instructions. Or if they bring in an over-the-counter or non-prescription medicine, the dental hygienist should be able to help them understand the label. The dental hygienist should discuss the name of the drug prescribed, what it is used to treat and prevent, the dose, the amount prescribed, and how often it should be taken. The dental hygienist should also tell the patient what to do if the patient feels that he or she is experiencing a side effect or an allergic reaction. The dental hygienist should have the patient repeat back what he or she has been told. This step should help to determine whether there is a knowledge gap. This is called the teach-back method, and it involves the dental hygienist giving instructions to the patient and then asking the patient to repeat it back so that they know that what they said was understood. The dental hygienist should answer any questions that the patient may have. And that is it for prescription writing and for the second lecture bite. Thank you.